Let's go.
Hi there. Welcome to the Ultimate Perimenopause podcast. I'm Dr. Shawna Drew, and I'm here today with my co-host, Maggie Chilton. Hi, Maggie.
Hi, Shawna. How are you?
Wonderful.
Good.
So today we've got Janet Walker with us. So Janet's an osteopathic manual practitioner and restorative exercise specialist in downtown Toronto. She has over 20 years of hands-on experience, and one thing I love about Janet is how she takes the time to teach her clients self-care and extend her treatments from the clinic into their real lives. Welcome, Janet. So nice to have you today.
Thank you. I'm so excited to be here. I've been listening to you and Maggie since the beginning of your podcast, and I really like it. And when you invited me, I was like, yay!
Yeah, and you're coming at a great time. Like we're at 7,100 downloads and counting at the moment.
Wow.
It's November.
That's fantastic.
Yeah, so we have to thank, this is a really good opportunity to thank every single person who listens to us, whether they download or not, or who shares our podcast. We are so, so grateful for listening to us and allowing us to bring people like Janet on, because you guys are saying that you're interested in what we have to say and what our guests have to say. So welcome, Janet.
Thank you.
So tell us a little bit more about yourself, how you got into this, about your own hormone journey, that kind of thing.
Okay, well, as Shawna mentioned, I have been doing hands-on therapy for over 20 years, which gives you the idea that maybe I've had a few hormonal issues in my life by now, right?
Mm-hmm.
So I started osteopathy school in my 30s. I didn't graduate until I was 44. It's kind of a long program. And in my program, I really focused in my thesis on treating pregnant women and really understood a lot about that age and phase in life. And one of the things I realized when I was working with that population is that hands-on treatment is fantastic, but self-care is essential. And so, as Shawna said, it's always been a point for me to give people self-care, whether it be exercises or, sometimes I refer to other professionals who can give them more self-care, but it's really been important to me. So that was a while ago. That was when I was 44 that I studied and finished my thesis. Now I'm 56. So I have gone through, or I hope I've gone through, most of the menopausal transition. And in my 40s, I thought I was super healthy. I was fit. I did yoga. I did Pilates. I did all sorts of things. I felt fantastic. And it didn't really hit me until I turned 51. And suddenly I didn't feel so great. I started having hot flashes. I stopped sleeping well. And I felt like a totally different person. I tried a lot of things to help myself. Some of them successful, some of them not. And now that I think I'm coming out the other end, I have this awesome new appreciation for this phase in life. And now I'm really trying to help women, not just pregnant women and postpartum women, but extend that knowledge and expertise to a whole other age range that I'm part of. So I guess that's a little bit about my journey so far.
Yeah, and I know that Shawna probably feels the same way, but we tend to, we can't say treat, but I know you guys can, attract clients who are in the same sort of age range as ourselves, because we're in it, we're living it, we can relate. And I find that a lot of people sort of are drawn towards you almost psychically, like they know that you're going through this period in your life. So these clients sort of come to you because maybe on some level they just know that you can help them and you can sympathize and empathize and be going through it with them.
Yes, absolutely. I find that. So I have lots of people who are my age. I still have younger people. I have lots of babies too. But I find that the population who's my age, we can really connect. And I hope I can make a difference for them.
Wonderful.
Mm-hmm. So we wanted to ask you about some of the things that you notice with women during perimenopause. So what kind of imbalances are common during this hormonal transition? And what, from your perspective, what do you think is behind the imbalances?
Okay, that's a really good question. I think that because I've listened to your podcast so much and I know a lot of the things that you talk about, I'm going to say one of the things that you talk about a lot, which is stress. So in my practice, I see people having all sorts of symptoms but often the underlying factor is stress and lifestyle. So from an osteopathic perspective, there's a lot I can do to address that. It's not all self-care, but there's a lot of that too. So some of the things I see a lot are nagging injuries that are starting to rear their head. Things like an ankle sprain that, I had that 20 years ago, and now for some reason I feel like it's bothering me again. Or pelvic dysfunction that people don't think that they're going to have because they thought they escaped without a problem after having their children. And now they're 45 or 50 and they don't really want to admit it, but they're having some mild incontinence, which they think is normal. What else? Headaches are common. And the foot thing is bunions. I see a lot of bunions, and people really don't love their bunions.
Wow.
I wish people would start to think about that earlier.
Yeah, that's an interesting one. I haven't come across that one yet. I'm sure Shawna has, but for me, that's a new one.
Well, probably in your field, people don't think about the connection as much. But in my field, they're going to, and also I get people to get undressed, Maggie. So I see things and I ask about things because I see them.
So what is the connection with bunions now? You have me curious.
Yeah, so bunions really have a lot to do with your pelvic health, the position and mobility of your pelvis. And a lot of people from postural habits and lifestyle stresses will have a posture that is kind of that tucked under bum. You hear a lot of the flat bum. I don't want to say the mom bum, but that's what people say. So I'll say it, but it's not my term. But that posture is really dysfunctional from a pelvic floor perspective, but that translates down your legs to your feet. So instead of the weight being through the center of your feet and balanced, it's like your foot when your foot hits the ground when you're walking, the forces go through toward the big toe and then revert the other way. So that joint undergoes a lot of stress. And it happens, you see young people with bunions, but I see it increasing toward this age. So that's like the short on bunions.
Wow. And I'm just
and they're preventable.
Well, this might be completely not right, but would you say that women who sort of have hernias, that kind of thing, is sort of related to that area, which then relates to bunions?
Well, that's an interesting link because hernias of all types are related to pressure problems, which from an osteopathic perspective are related to your alignment. So if you think about your torso, your abdomen as a container, and the container should be vertical with your thoracic respiratory diaphragm on the top and your pelvic floor on the bottom. If those are not in sync, then you get excess pressure in the abdominal pelvic cavity. Mm-hmm. That can manifest up as a hiatus hernia, reflux, indigestion. It can manifest forward as diastasis recti or an umbilical hernia, or lower down as an inguinal hernia, or even further down at the level of the pelvic floor as either incontinence, pelvic organ prolapse, that could be your bladder, your uterus, or the rectum, hemorrhoids, anything that's really, it's just putting too much pressure into the system. Yeah. So although hernias might not be directly associated with bunions, if you have those things, you've got to take a look at your alignment and see, is there some changes I can make here? Because those changes could ultimately result in affecting your foot and gait.
Well, thank you for, what's the word I'm looking for? Entertaining me there, because that was just, but I did have somewhere where I was going with that. So thank you. That makes a lot of sense to some clients that I've seen. So thank you. And I'm
okay,
sure
good. I'm glad you found it helpful.
Yeah.
So is it the shift in hormones that creates these imbalances in any way, or is it just chronic dysfunction and using the muscles incorrectly over time?
Oh, such a fantastic question. It's such a fantastic question.
Shawna is very good at that.
I know. And she asked me those kinds of questions often when we're talking and I'm like, oh, gee, I don't know. It's so hard to really know the answer, isn't it? I mean, we think of the hormones. Sometimes even people think about, okay, the female hormones, the estrogen, progesterone, those things, but we can't separate those, as you both know, from the adrenal hormones, from all of the other hormones. So I think that hormones have a big impact. And if you haven't started to experience the perimenopausal shifts yet, you certainly could be affected by adrenal hormone dysfunctions or pituitary or thyroid. There's many things that all interact to contribute. But I think that from an osteopathic perspective, of course, alignment matters. And the wear and tear that you subject your body to through imbalances, muscular imbalances, and alignment contributes. So I think everything is multifactorial and we can't really separate, but I can help people with their alignment. Maggie, you can help them with their nutrition. Shawna, you have other insights, but we need to always think about the whole person when we're treating someone or helping someone.
Mm-hmm.
Was that kind of an answer? Mm-hmm. Yeah. So I'm going to add to that about structure is when you talk about aging. Yes, aging is a process, and there are, you don't have as much growth hormone anymore. Everything does change. But if we attributed everything to the hormonal changes and just the quote unquote aging process, we would expect more symmetrical bilateral issues. So if you come to me and you have, a bunion on one foot or a knee problem or an elbow problem, whatever your problem is, you have two knees. You use them both pretty much equally unless you participate in a sport that's really hard on your body on one side. So if you have a problem only on one side and both your knees are 56, odds are there's something that you've been doing habit-wise, or there's something in the way your body parts are positioned relative to each other that has contributed to that. Right? We can't just blame aging. We have to take some responsibility.
And then that should give you the warning bells to say, we need to look into this. Absolutely. But it's not quote unquote normal.
Yeah. And a lot of people come into my office and say, oh, well, I just normal aging stuff. When I go through their medical history, just normal aging stuff. I'm like, well, let's look at that. Is it normal aging stuff? Or is it something that you're doing or something that happened to you a long time ago that your body has been really doing a good job of adapting and compensating for, but just really can't do it anymore? It doesn't have the capacity. It's like the drop in the bucket, right? You have one little injury and then we have another injury and then something else happens and then your stress increases and suddenly your body just can't cope anymore and you experience a problem.
Yeah, I mean, to me, one of the key words that jumped out there was compensate. Like your body is always compensating for the stress, and it's not just physical stress, right? It's mental stress, hormonal stress, lifestyle, like just stress in general.
Absolutely.
As you get older, me personally, and I know a lot of people in my field kind of think, whoa, that's not normal. Like people view aging as, well, that's just what happens. I'm supposed to feel aches and pains and I'm supposed to not sleep and I'm supposed to, but then when they do finally have that wake up call and they go and see, a wellness professional, and we're like, no, none of this is normal. Let's figure out.
Common.
Yes, because they talk to other people. Oh yes, I had that, no problem. But when you go and talk to somebody who's in the wellness field, then you start to unpack all of those layers, and then those aha moments. I've had numerous ones myself, where you sort of saying, "Oh, right, that's why that happened," and okay, could that be why? And it's just, and then it's sort of like unraveling a present that's got about 50 layers to it. That we wonder how we coped before. Now we have this new information that means that our lives could be so much better if we did X, Y, and Z.
And I will add to that, that when you were talking about things that are common and are they normal, I think human nature is such that it seems to me in my circle of friends, we often complain about the things that are bothering us. So women will share that they're not sleeping well or they're having hot flashes or whatever. Unfortunately, the women who are not experiencing those things don't speak up, because we don't seem to share the things that are good in our lives for some reason. I think that is a good thing to do, and I wish we would all do it a bit more. But so you hear your friends and or you heard your mother or your aunts or whoever, the women in your life, sharing things that are not always so good. And then when you experience those things, you really do think that that's normal, because that's what happened to them.
Mm-hmm.
And there are lots of women who are not experiencing those things, right?
Yeah, and you're absolutely right.
Yeah.
I do wish that more people would say, you know what, I had a fantastic sleep last night. Tell me how you did that. Yeah. Or, I went for I walked for an hour every day this week and my knees feel great. I just feel so relaxed. Okay, tell me what you did. Whereas you're right, people don't share that in general because maybe they don't want to seem like they're bragging, or, their life is so much better, or whatever the reason. But maybe we need to change our perspective of that. Maybe our response to that would be, well, I'm not. So then that's going to make people say, well, I'm not going to say anything anymore. So I think it's
tricky.
It is.
Yeah,
especially when you're going through perimenopause and menopause. Because so many of us are struggling in certain areas, but we also need the flip side where, people are saying, you know what, I don't have this, or I've had this and this is what I did and it's amazing and want to share it.
Yeah, I agree. And I think that the more you share the changes that you make and the positive response that you have to those changes, the more you help empower other people to make those changes. Mm-hmm. I personally tried to believe for a really long time that the caffeine I consumed, which was not a lot, but a cup of coffee most mornings, and the wine that I enjoyed in the evening, not a lot, but on a regular basis, that those really didn't affect my sleep or my hot flashes. I was sure.
No.
Nothing to do with it at all.
Yeah.
Right? Because I would experiment. I would take a period of time and I wouldn't have those things and I wouldn't see a shift. So I'd be like, well, there. Confirmed. There's no connection. But then I realized that when I do those things and I do it for enough time for it to actually make a difference, that it does make a difference. Mm-hmm. But these are not quick fixes. I think that all of the things that we do in our professions, they're not quick fixes. So if someone comes in for an osteopathic treatment, they may notice a difference right away. It may take a few days, but really it's probably mostly going to show as a benefit over time with their own contribution to self-care, whether it be a stretch or, a relaxation exercise or something like that. So we also have to just sort of put out there that change takes time. Mm-hmm. And we have to be a little bit patient. It's not a quick fix.
And a lot of us not good at patience.
Yeah. Yes, I don't really know what you're talking about, Maggie.
No, I'm getting better. But, yeah.
Yeah. Well, we're female entrepreneurs and we like to make stuff happen, right?
Mm-hmm. Yeah. Mm-hmm. Shawna. Mm-hmm.
Yes. Yeah. So tell me more about the self-care that you send people home with. So what are some examples of self-care practices that a patient or client would have after a visit with you?
Okay. So I base most of my thinking, it's kind of like a really simple little formula. ABC, alignment plus breathing equals circulation. We're all about flow of everything, hormones, fluids, whatever. So alignment and breathing. Those are my two quick things. So I almost always give people a little lesson on standing alignment, or if they're a person who works at a desk all day, which many of my clients do, a little lesson on sitting correct sitting posture. It's not a lecture, it's just a little tip. So if you're sitting in your office chair, think about where your weight is. Do you have weight on both sit bones, or are you kind of shifted to one side?
Sit up now because I'm my leg.
I'm not, no judgment, people. We're just learning, right?
Yeah.
But a lot, or a lot of people have their tailbone sort of tucked under. They're sitting more on their tailbone. They're not on the sit bones. Or they've got their chest really up and out, and that's creating a lot of compression in their spine and contributing to forward pressure in their body. That what we talked about earlier, that pressure that contributes to hernias or diastasis or those things. So a little touch on that, and breathing. And almost everyone I ask thinks they're a good breather. And then we start working and I come in contact with their diaphragm and they feel a tension. Oh, that's uncomfortable. What are you doing? Well, that's your diaphragm and it's tight. And so let's work on that. Let's teach you how to get your rib cage expanding with your breath. So that's usually another little homework that I do. Something really simple, tie a stretchy band around your rib cage, or even just, your bra strap or heart rate monitor strap as a force that you can think about breathing into, so that you get your rib cage expanding, and then you exhale. We need to exhale. A lot of us are all about, we're always trying to get air in, but we never let the air out. So if you just have a nice long exhale and then a little pause, your body knows to take in oxygen. You don't have to lift up your chest and do a big suck in. It'll come in. So that's usually my second thing, or whatever order I do them. But those are definitely two of my top three. There's a third. I'll wait in case you have another question, and then I'll talk about the third one.
So what happens if you're not breathing properly? Like what are the signs that you would see? I mean, the first thing that comes to mind for me is anxiety, but what are the other ways that would manifest?
Anxiety is definitely one. Headaches are frequently, breathing is a contributor. So if you think about breathing, as we're sitting here, most of us are breathing up. We're using our small neck muscles to lift our chest to get a breath. If you just put your hands on your body, for anyone, you put one hand on your chest and one hand on your belly or your rib cage, take a breath. What moves? If you're sitting, odds are it's your upper hand. If you've been practicing, maybe not, but normally it's that upper hand. So what's happening, instead of your diaphragm and your intercostal muscles, the little muscles between your ribs really doing the work, it's these big muscles in your neck. And they get overworked and tight and tired. When you get a lot of tension in those neck muscles, that actually inhibits circulation and drainage from your head. So you get a congestive type of headache where you just feel like pressure in your head, or you can get more of a trigger point referral kind of headache, where the headache might come up, it might wrap around from your neck on one side, over your ear, toward your eye. Those kinds of headaches are from muscle tension, often around the neck, that is the breathing or shallow breathing is a contributor to. That's one thing from breathing. The second thing is that breathing and not breathing well contributes to the pressures in the abdomen and pelvis. Back to what we talked about earlier, those pressure problems contributing to all of those pelvic abdominal health issues, including digestion.
Interesting.
Even constipation, because when you breathe and your diaphragm moves up and down, and hopefully your pelvic floor moves up and down with it, everything in all those organs are moving too. And your colon particularly likes movement. It likes the movement of breathing. Sorry about that. And it really loves walking. It really loves walking, which is a whole other story. Oh, that's another tangent. Yeah, walking and colon health.
Yeah, that's what I tell my clients. If you're not moving your bowels, then you got to get outside and go for a walk.
Move your body.
Guarantee it'll catch you unawares and be like, oh, where's the bathroom?
Yep.
So I was really interested in your title, and Shawna had written a question, but it's about restorative exercise specialist. What exactly is that? Because Shawna was saying that she's seen that pop up frequently now. This is new to me, so I'm really interested in what that actually is.
Yes. So that designation, it may not be a trademark designation anymore, but I got that designation from my work with Katie Bowman, who is really all about alignment. She had a book, Alignment Matters, which I read years and years and years ago. And the first blog post of hers that I read was describing pressure problems, what I just described to you, in layman's terms. And I was blown away. I mean, here is someone who's in the exercise and movement world who's talking about exactly what I'm talking about every day and putting it out there for people with exercises to help them correct these things. So I was hooked from the beginning. So I did her certification program, which involved, learning a lot about the human body from an alignment perspective, which was right up my osteopathic alley, but adding in the self-care component, the actual exercises that you need to do to improve your alignment. And so as a restorative exercise specialist, that's what I add to my osteopathic practice, is really the looking at your body and how it's moving and giving you really targeted exercises. So it's not the big picture exercise. It's not necessarily strengthening. It's not necessarily stretching, but it will improve your flexibility, your mobility, and your strength, because when your body is in the correct alignment, it functions better. Mm-hmm. And I also want to add something, because people talk about alignment a lot, and some people sort of dismiss the idea of alignment, and they'll say, well, it doesn't matter. I think it does matter, but alignment is not static. I like to think of alignment as dynamic. So of course you can put your back in extension. You can put your back into a twist. You can sit if you want to sit like this for a while, but I want to make sure you can also sit like this. So it's not just a spot in like you don't always have to hold a certain posture, but can you come back to a position that is beneficial for your joints, your circulation, the function of your organs. That's what alignment is to me.
Yeah, I love the title. I think it's great, and it says what it does on the box.
Right? Absolutely. It's all about movement, really. It's all about movement and helping your body move in healthy ways.
Yeah.
Cool. So could you just go through like a couple of examples of what these exercises might look like? Because I'm just having a hard time conceptualizing it, other than, paying attention to your breathing or something really,
right,
really important and simple.
Okay, so let's do one of my favorite, most attractive ones. A lot of us sit at desks. I don't have to sit at a desk, which is fantastic, but I have to bend over people every day, and so I get it too. Is that sort of forward head posture? And a lot of times you see on the internet those pictures of where the head is forward, how it weighs more. I don't know if it really weighs more or not, but I know that it's not a healthy position for your neck. So if you do a little check-in and you feel, where is my head relative to my shoulders? For many of us, it's a little bit forward. So a corrective for that would be to try to put your chin back. But if you try to just put your chin back, you'll see that your chest will pop up. Mm-hmm. So what I like to do is I like to teach people that their sternum should be vertical. So if you put your hand on your chest and you really put it on your sternum and let your rib cage relax down, you'll get a vertical sternum. Then you want to push your chin up and back. It is the most unattractive exercise. Whenever I do videos of this, I'm horrified.
Want to get rid of that thing right there?
Exactly, Maggie, exactly. But you know what? If you do it often and you correct your alignment, you'll start to lose a little bit of that because your head's in a better place. But when I do it, I say aim for as many chins as you can get. So you're pushing your chin. You're not doing it in public normally, right? You're doing it while you're brushing your teeth or whatever in front of your bathroom mirror. Yeah. But you're pushing your head back, holding your sternum down so that you feel that you're lengthening the muscles in the front of the neck and the back of the neck. Because if you're like this muscle in the front is short and tight, but the back of the neck muscles are tight too. So hold your sternum down, push your chin back, feel the lengthening in the back of your spine. And if you do that a few times when you're sitting at your desk, you'll feel the difference. That it sort of helps you clear the brain fog. It makes you think better. So that's a good one. Can you picture that one, Shawna?
I get as many chins as possible. I like that.
As many chins as possible, right? And I'm finding more and more. Yeah,
chins
more and more
are good.
chins. Chins are good. Chins are good. Another one is something as simple as the position of your feet when you're standing or walking. Are your feet sort of pointing out, like that sort of duck foot position? Or are your feet pointing straight ahead? Are your feet really close together? Or are they at pelvis width? Ideally, you want your feet at pelvis width, pointing straight forward. That's going to help your pelvic floor a lot, because when they're too close and they're turned in or out, the muscles in your pelvic floor are affected. So
now I have noticed recently, my 9-year-old, his right foot kind of flops and goes to the side when he walks. I haven't seen that before. And recently I've been like, oh, that's interesting.
Yeah. So that's the sort of thing that is good to take a look at, because if you don't look at it and you don't find out what the cause of that is, that's going to become a habit.
Yeah.
His body's going to need to adapt and compensate. And then when he's our age, he'll be wondering why he has a bunion or a sore knee. So it might be coming from his hip. It might be coming from the knee. If you take him to see an osteopath, they can maybe help figure out where it's coming from.
I've got it on my list.
Get on your list. I'm sure there are some good osteopaths in London.
If not, I'll come to Toronto.
Right?
Yeah.
And then are those a couple of good ones, Shawna, in terms of?
Those are perfect. Yes.
Yeah. And then can I tell one more?
Yes.
Okay. So my absolute favorite is a psoas release. So most people have never heard of their psoas, or if they have, they can't really picture it. There's actually two, because most muscles, you have two of them, but they're large muscles deep in the abdominal pelvic cavity. They attach from basically the bottom of your rib cage. They attach to every single vertebrae from T12, L1 down. They pass through your pelvis and they attach to the top of your leg. So they can pull your ribs up and back. So you do like a rib thrust posture, and they can pull your legs forward and rotate them out. The reason I care about the psoas a lot is because in front of the psoas, gliding up and down on the psoas, are your kidneys. And really it's kind of like the psoas is the nest for the kidney, which is not firmly attached. It glides on the psoas. If your psoas is restricted and not moving well, that will affect your kidney mobility from an osteopathic perspective. I'm not talking about like a big kidney problem. Do you know what I mean? I'm just saying that it's not ideal from a mobility point of view. And then you also have your diaphragm, and your diaphragm has little legs that reach down. The crura of the diaphragm reach down, and the arms of the psoas reach up, and they intersect. So tension in the psoas affects the diaphragm. Excuse me. Tension in the diaphragm affects the psoas. And then when you think about the kidneys, on top of the kidneys are the little adrenal glands. And then on one side, you've also got your liver, which is directly under the diaphragm in front. So the tension in psoas can affect the organs and your breathing. So it's a big one for me. Most people have a lot of psoas tension because when you're sitting, it's in a shortened position. And it is a muscle that is highly affected by stress. It is your fight or flight, get ready to run muscle.
Oh, mine's going to be like majorly stressed then.
Well, you and most people that I see. So what I teach people is a really simple restorative posture that is just a release. All you have to do is hang out in the position. You bolster your upper back and head. You let your lower back be able to just sink back toward the ground in gravity. And that lets it passively release. You're not adding any stress to your system. You can lie there, you can relax, you could do your meditation, you could do your breathing. You just chill out. And as you lie there and relax, you will feel over time that muscle just lets go and lets go and lets go. And your lower back just opens and feels so much more free. So that is my favorite exercise. It's kind of hard to describe, but what I can do is I can share on my website. I have a picture of it, and I can post a little article or link if you want a link to it. Great. I can put it on.
Yeah, that would be fantastic.
Yeah, it's a good one.
For those people who are not watching but listening, how do you spell the psoas? How do you spell that?
Psoas.
Okay, interesting.
Psoas. Yes.
Because some people are thinking, I got to Google that, and then they don't have to Google it.
And then if they're like many of my clients, they'll Google it and they'll find this stretch that's very intense, and they'll come back to me and they'll say, well, I Googled the psoas and I found a really good stretch for it. Let me show you. And I'm like, no, please don't. Let's start with the release, because I'm not saying you shouldn't stretch your psoas. That's great. But until it's got a little bit of length and a little bit of release and is healthy, you don't want to make it more stressed by really putting an intense stretch on it. So just start with a nice release and some breathing and let it restore itself before you challenge it.
So you can Google what it is, but then come back.
You may Google a picture
to our podcast, click on the link for your description and your exercise. Is that right?
Yeah, it's a release. Yes.
Okay.
A release.
So come back. Yes.
Come back.
Awesome. So, I mean, you've told us so many great things to practice at home, but I'd like to just sort of wrap things up with our podcast today with some take-home practices for our listeners. So if we could summarize all of what we talked about today, what are some of your top tips of things that we could start doing right away?
Okay. My top tips for right away, I got to think about these. Check in with your breathing. Take time, maybe once an hour, just spend a minute dialing into your breathing. And if you're feeling it's all in your upper chest, put your hands on your ribs. Take 3 deep breaths. And actually what I should say is do 3 full exhalations, because if I say a deep breath, you might just try to suck more air in than you need. So really just breathe, but really focus on the exhale. That's a really easy takeaway, I think. And then take a look at your feet. Just take a look at them. Even better if you take off your socks and see if you're starting to get a bunion, or see if you've got a toe that's looking like it's a bit kinked or crooked, or your feet are cold, or just observe your feet, because your feet are important to the rest of your body, and things in the rest of your body can be affecting your feet. So just look at your body and try to listen to your body.
That's actually an ongoing theme, isn't it, Shawna? The listening to your body. I think if we don't say it in every podcast, we pretty much say it in every podcast, because it's so overlooked. But I like to look at your body too. Listen and look. We need one more L, but listen and look.
Learn.
Yeah. Learn. There you go.
Right? Yeah.
That's great.
Yeah. No, I think that it's really important, and people often don't really get what listening means, but just pay attention to what you're experiencing. Some people like to do a body scan, whatever works for you. But if you're feeling something and it doesn't feel right, pay attention, make a note of it, maybe make a note of under what circumstances you're feeling it, so that you can start to look for cause and effect or correlation. That's how I think of listening to your body.
Yeah, and maybe see if there's a pattern that's actually going on as well.
Right?
Yeah.
And are those a few good ones, Shawna?
Definitely. And then we've got the exercises that you talked about.
Right.
And
as
many chins.
Walk.
As you can.
Walk. I encourage everyone to walk for the health of your bowels and your whole body.
Good. that I love that. I love that. I couldn't get out and walk today, unfortunately, but the last 2 days here have just been phenomenal. And I was sort of back to my old routine of going out for an hour walk and listening to my audiobooks, and it felt so good.
So fantastic, isn't it?
Mm-hmm.
Yeah.
Got a little bit of sunburn. I forgot about that, but that's okay.
It's okay. It's okay.
Yeah.
It's worth it, right?
And then you think, oh yes, I need to remember that sunscreen. So then you
It's
put
hard
it
to
on.
remember this time of year because it doesn't feel that hot yet, right?
Mm-hmm. Yeah.
Mm-hmm. Awesome. Well, thank you so much for joining us today, Janet. As usual, I always learn a few new things from you, which is amazing. And for me, it's always a good reminder about how important, structure and alignment are for function as well. And it's something I'm still just getting the hang of referring and talking and, and teaching myself as well. So I really appreciate all of this insight, and hopefully our listeners got a lot out of it today as well.
Well, thank you very much for having me. It was a pleasure. Thank you for indulging my little passions for things like the psoas and our feet and breathing. And yeah, I've had a fantastic time here with you today.
Yeah, it was great having you here. I've learned a lot.
Thank you, Maggie.
Yeah.
All right. So if you like the podcast, please subscribe to our channel. This will be up on YouTube as well. So please have a look over there, the Ultimate Perimenopause Podcast, and give us some likes. And thank you so much for joining us again and for sharing and spreading the news. Have a wonderful day.